Hey, future nurses. I'm Toya.
And I'm Shay, and we're Sisters Nursing. Welcome to our channel where we discuss all things nursing.
So today we're diving into pH wars, acidosis versus alkalosis.
One is slow and acidotic.
And the other is twitchy and basic.
On one side, you have sleepy, sluggish acidosis.
And the other, you have overstimulated, jittery alkalosis.
Let's talk the normal pH levels, 7.35 to 7.45.
So anything less than 7.35 is considered acidotic. Anything greater than 7.45 is alkalosis.
Acidosis, my pH is low. Everything feels slow. Muscle weakness, shallow breathing, leave me alone.
And for alkalosis, my pH is high. My heart is racing, fingers are tingling. I can run a marathon or have a panic attack. Ooh, woozy face.
So you have a patient with confusion, lethargy, and Kussmaul respirations. What do you think you have? Exactly. Acidosis. In respiratory acidosis, your body is trying to blow off CO2 by breathing rapidly. I'm breathing like crazy, but it's not helping. Send me bicarb.
Then you have a patient complaining of lightheadedness, numbness and tingling, and Shavastic sign. What do you think that is?
Exactly. Alkalosis.
The tingling and muscle twitching is due to low calcium and potassium shifting around. I feel like I'm on a 5-shot of espresso, but it's just my pH.
Let's interpret some ABGs. Respiratory opposite, metabolic equal, Rome. So you have a pH of 7.29 and a CO2 of 55. Your bicarb is 24. This is respiratory acidosis caused by hypoventilation. Think COPD, drug overdose, or anesthesia. Please ventilate me.
Then you have a pH of 7.50, CO2 of 32, bicarb of 24. This is respiratory alkalosis caused by hyperventilation or panic attack, pain, or fever. So in this case, breathe in a paper bag.
So with respiratory acidosis, your causes often include hypoventilation, I'm holding on to all my CO2, COPD, opioid overdose, and airway obstruction. In metabolic acidosis, your causes often include DKA, renal failure, and diarrhea.
In respiratory alkalosis, your symptoms usually are caused from hyperventilation, anxiety, and high altitudes. In metabolic alkalosis, your causes include vomiting, remember, I'm losing acid, diuretics, and NG tube suction.
So let's treat this patient. If it's acidosis, we're going to give oxygen and ventilate if it's respiratory, of course. Treat the symptoms or the cause. So if it's DKA, we give insulin, monitor potassium, and watch the LOC, level of consciousness.
If it's alkalosis, you're going to treat the hyperventilation. So slow the breathing down. Let them breathe in a paper bag and replace those electrolytes. If it's metabolic alkalosis, you want to give them antiemetics to help with the vomiting, stop diuretics, and stop suction.
So remember, acidosis is slow, low pH, and sleepy.
And alkalosis is high pH, and twitchy.
Know your numbers, treat the cause, and recognize those signs
to save lives.
If you found this helpful, please don't forget to like, comment, and subscribe.
Happy studying!